Before people develop diabetes, they almost always have prediabetes, blood glucose levels that are higher than normal but not yet high enough to be diagnosed as diabetes. Prediabetes puts you at higher risk for developing diabetes. Diabetes is a condition in which your blood glucose or blood sugar levels are too high. Glucose comes from the foods you eat. Insulin is a hormone that helps the glucose get into your cells to give them energy. With type 1 diabetes, your body does not make insulin. With type 2 diabetes, the more common type, your body does not make or use insulin well. Without enough insulin, the glucose stays in your blood. There are no clear symptoms of prediabetes, so you may have it and not know it. Some people with prediabetes may have some of the symptoms of diabetes already. You usually find out you have prediabetes when being tested for diabetes. If you have prediabetes, you should be checked for diabetes every 1 to 2 years. Over time, having too much glucose in your blood can be very hard on your blood vessels. Diabetes can affect any organ, but organs dependent on blood flow are most dramatically affected. Those organs are the heart, the brain, the eyes, and the kidney. This puts you at increased risk for developing heart disease and stroke. If there's one thing that you can do to reduce your risk for developing diabetes, it would be to maintain a healthy weight by watching calorie intake and getting plenty of exercise. By following these recommendations, you can reduce the risk for diabetes and even the need for medications. If you have the diagnosis of diabetes, you should also monitor your glucose level and take medication as prescribed by your healthcare provider. If you're having trouble keeping your blood sugar level in target range, ask your diabetes healthcare team for help. If you have diabetes, taking your medication and checking your blood sugars regularly is extremely important. But it is also important to know how to take care of your diabetes through your diet.
Diabetes and prediabetes are directly tied to what you eat and drink. First, you should agree on an amount of carbohydrate with your doctor, dietitian, or nurse that is suitable for your medication level. Sticking to this amount of carbohydrate at each meal will help your medication to do its job, and your blood sugars will remain stable. Most diabetics are allowed between 45 and 60 grams of carbohydrates at each meal. But how do you know which foods contain carbohydrates and which do not? We can help. Let's start with the basics. Foods that contain carbohydrates include grains, fruits, starchy vegetables, some non-starchy vegetables, and dairy products. This does not mean that these foods are off limits to you in any way. In fact, we encourage you to eat from all of the food groups. But in order to do so safely and control your blood sugar, you will have to monitor the amount of carbohydrate you eat at each meal or snack. Counting carbohydrates per meal is the best way to have control over your blood sugars, but you can also do this with proper portion control using a plate. If you're not ready to count carbohydrates, consider portion control as an alternative method to blood sugar control. First, take a 9-inch plate and divide your plate in half. This is where you will place non-starchy vegetables like spinach, carrots, lettuce, greens, cabbage, green beans, broccoli, cauliflower, tomatoes, cucumbers, mushrooms, peppers, etc. Now divide the remaining half into quarters. In 1 quarter, place your starchy vegetables or grains like potatoes, pasta, rice, tortillas, corn, pretzels, whole grain breads, or lima beans. Finally, place protein foods in the last quarter. This includes foods like lean chicken, beef, turkey, pork, fish, tofu, or eggs. You can add either a serving of fruit or a serving of dairy to your meal. Using this portioning method will help you to consume the same amount of carbohydrate at each meal, controlling your blood sugars. People who have already been diagnosed with diabetes and are eating healthfully will have better blood sugar control. If you're on oral diabetes medication, eating well can even eliminate the need for medications if you eat right and lose weight.
If you have been told you are pre-diabetic, you may be able to reduce or eliminate your risk for diabetes if you change your eating habits now. As the wellness program nurses described, prediabetes is a critical point before a diagnosis of diabetes where you can make changes to reduce risk. Reduce the amount of processed foods you consume. This includes fast food, snack foods, pizza, cakes, cookies, and candy. Reducing these foods will reduce the amount of simple carbohydrate and total calories you consume. Switch to whole grains. Switch from white bread to whole wheat bread and swap out sugary breakfast cereals for breakfast cereals with at least 5 to 8 grams of fiber per serving. Whole grain foods help stabilize your blood sugar and keep you fuller longer. Increase your intake of non-starchy vegetables. Non-starchy vegetables contain only a very small amount of carbohydrate, are high in fiber and nutrients, and naturally low in calories. Increasing non-starchy vegetables in your diet will reduce the total calories you consume and help you shed pounds. Add in fruit. Fruit does contain carbohydrate, but it's not off limit to diabetics or pre-diabetics. In fact, it contains important nutrients and is naturally lower in calories than other carbohydrate-containing foods. Add a piece of fruit to meals and snacks. Exercise and eat right to lose weight. Eating right will help put you on track for weight loss, but you can't successfully control your blood sugars and lose weight without increasing physical activity. Work up to 30 minutes per day of exercise and add in muscle strengthening exercises to help burn calories and build lean muscle.
We're encouraging you to change your habits because having diabetes or being told you have prediabetes should be a serious wake-up call. These are conditions that can affect your quality of life if you do not take the initiative to make healthy choices.
We want you to succeed and we want you back in control. For more information on healthful eating with prediabetes and diabetes, visit the Strive for Wellness section of the MCHCP website.